Thanks for joining us. One of the most closely watched votes on November 6th is ballot question 1, and that's the question that deals with nurses and staffing. Now, this is taken right from the Secretary of State's website. A yes vote would limit the number of patients that could be assigned to one registered nurse in hospitals and certain other healthcare facilities. A no vote would make no change in current laws relative to patient-to-nurse limits. This is hardly a simple decision. We're talking with our Dr. Mallika Marshall and our political analyst, Jon Keller, here, who rarely appear together, so this is a treat for all of us.
This is like shattering the fourth wall, or whatever they call it in theater.
I'm glad I got to be a part of this. I want to start with you, Doctor, because, even the ads can be confusing. You see nurses, some of them saying yes, some of them saying no. As a doctor, how do you feel about question 1?
So I think it's fair to say that the vast majority of doctors and the vast majority of hospitals are against question 1. And based on my understanding of the most recent poll that I've seen that was conducted by WBUR, almost half of nurses are also opposed to question 1. And I think perhaps even more now that we're sort of getting more information about what the repercussions could be. Let me tell you personally, I have worked at probably a dozen or so hospitals or hospital-like places over my tenure as a doctor in the greater Boston area, large academic centers, community hospitals, urgent cares, the VA. And every place I've worked, the nurses are remarkable. They are experienced, they are professional, and they are fiercely defensive of their patients and the quality of care that they provide. And they are really good at sort of deciding how to shuffle patients based on acuity or volume, based on the experience of the nurse. They're the first to report to administrators or doctors that things are sort of getting out of hand and they might have to start turning patients away. And that flexibility is so important in healthcare, especially because we have so many different types of places, right? A large cancer center is different from a psychiatric hospital, is different from an emergency room. And allowing those individual places to make staffing decisions, I think, is really important. If this passes, hospitals are going to be mandated to keep certain ratios, and if they fail to do so, they are going to be fined exorbitant amounts of money. And that means that there's some community hospitals that might be at risk of closing down. Even at some of the larger hospitals, some units may have to close down, and that's because they're going to have to reshuffle nurses, so they might have to bring nurses up from the emergency room or bring nurses in from outpatient programs in order to comply with the mandate. If they don't, they're going to lose a lot of money. And that means less access to care for patients. Outpatient programs, longer waits in the emergency room, substance use disorder programs, mental health beds, all of these things that we're already busting at the seams to try to accommodate. And greater expense that is going to trickle down to the patient, unfortunately. So I know it sounds wonderful in theory, and they have some really compelling ads out there that make it sound like it's in a patient's best interest, but in my humble opinion, I think you should vote no.
Okay, and there are, and to be fair, there are nurses who say we are in an environment where we need extra support, and obviously those are the healthcare professionals who are driving this, but it isn't just the medical community, Jon, that's split on this. If you look to your political leaders to sort of decide how you should weigh in, they're also split on question 1.
Yeah, and Dr. Marshall's eloquent analysis notwithstanding, from a straight political viewpoint, this should be a slam dunk. Who doesn't love nurses? If you've interacted with the healthcare system at all, had to be in a hospital, I've had to be around hospitals quite a bit the last few years with ailing elderly parents. And I worship the ground these nurses walk on, male and female nurses. They're wonderful. They're your lifeline. The doctors, God bless them, often blow in and blow out. They don't even really know who you are. Yep. I'm sure that's not true of your patients. Doctor,
no, it's the nurses.
You know what I mean.
I completely agree.
So it should be a blowout in the polls, but it's not. And I think there are a couple of reasons for that. First of all, this is being driven, and question 1 is being promoted by the Massachusetts Nurses Association, the largest nurses union in Massachusetts. I believe less than 25% of the working nurses in the state belong to this union, and that message has gotten around. And there's been resistance in this state in recent years to the idea of, to the political muscle that unions manifest. And I think in this case, there may well be some resistance to the idea that a complex issue is going to be litigated or mandated through the blunt instrument of a ballot question, because this was before the legislature in the form of a bill for years, and they rejected it. They wouldn't go for this. That's why it wound up in the ballot. I think there's just a lot of people skeptical of union clout and skeptical of this way of legislating.
And we should be upfront about this. Senators Markey, Warren, Mayor Walsh, they're all voting yes. And yet you have a lot of other lawmakers saying, stop and read the information about this, learn what you can, and there's a reason why hospitals and doctors are saying no at this point.
And this doesn't mean that there aren't problems. I mean, there are problems. Yeah. There are nurses that are out there that are overworked, that are overwhelmed. But the fixes need to be in those particular places, in those particular units, hospitals, urgent cares, emergency rooms, whatever it is. This should not be a statewide mandate because it can't apply to every place where we take care of patients. And as a fierce defender of patient access to care, I am just so fearful that this means patients are going to have even less access when we already have patients out there who can't find primary care providers, who are waiting for hours in ERs to be seen. I think it's going to make a bad situation worse.
And just one more super quick note about the political environment of all this. This is not happening in a vacuum or in a place where the average man and woman on the street doesn't know anything about the healthcare system. Healthcare is such a big industry here. We're so invested in it on so many different levels. Just the sheer volume of people who interact or work in the healthcare industry, that everybody seems to have an opinion on this. I get stopped by people on the street with informed opinions on this. So it's not like the TV ad campaigns can just bowl people over necessarily on either side. People have their own resources of accessing knowledge and certainly their own opinions. We Bostonians are nothing if not opinionated.
That's right, and we'll be sharing those opinions right up until Election Day on November 6th.
And people can watch the results on election night here on WBZ and
nice plug,
Channel
John.
38 and CBSBoston.com, right?
Absolutely. We will be here for you, and thanks for being with us.